Introduction Narrator. Welcome students to today's lecture on magnetic resonance imaging, MRI, techniques. In this comprehensive script, we will explore various aspects of MRI, including different techniques and their clinical applications. So let's dive right in. The field of radiology has witnessed remarkable advancements in diagnostic imaging, and MRI has emerged as one of the most powerful modalities. MRI utilizes a strong magnetic field and radio waves to create detailed images of the human body. This non-invasive technique provides valuable information about the anatomy and function of internal organs. Magnetic resonance angiography, MRA, is a specific MRI technique used to visualize blood vessels in a non-invasive manner. It offers exquisite spatial resolution, providing detailed information about blood vessels, their morphology, and blood flow. MRA plays a crucial role in the evaluation of vascular diseases, such as aneurysms, arteriovenous malformations, and stenosis. Diffusion-weighted imaging, DWI, is a specialized MRI technique that captures the movement of water molecules within tissues. It is particularly useful in the detection and characterization of acute stroke, where restricted diffusion can indicate ischemic tissue. DWI also has applications in assessing the viability of tumors and evaluating inflammatory processes. Magnetic resonance spectroscopy, MRI, is a technique that provides information about the chemical composition of tissues. By measuring the levels of specific metabolites, MRI helps in diagnosing and monitoring diseases like brain tumors, liver disorders, and psychiatric conditions. It supplements traditional MRI by offering insights into the biochemical changes occurring within tissues. Perfusion-weighted imaging, PWI, is a specialized MRI technique that assesses blood flow within the brain or other organs. By tracking the distribution and speed of contrast agents, PWI aids in the evaluation of cerebrovascular diseases, such as ischemia, vasospasm, and tumor perfusion. It provides valuable information about tissue viability and helps guide therapeutic interventions. Functional MRI, FMRI, is a technique that enables the visualization of brain function by detecting changes in blood oxygenation levels. By mapping neural activity during specific tasks or stimuli, FMRI helps in understanding cognitive processes, language functions, and identifying brain regions responsible for various functions. It has emerged as an essential tool in both clinical and research settings. Susceptibility-weighted imaging, SWI, is an advanced MRI technique that highlights susceptibility differences within tissues. By exploiting the magnetic properties of deoxygenated blood, SWI provides high-resolution images of venous structures and microhemorrhages. It has proven valuable in detecting and characterizing various neurovascular disorders, such as cerebral microbleeds and traumatic brain injuries. Parallel imaging techniques are a group of methods that accelerate MRI acquisition by using multiple receiver coils. By collecting and combining data from different coils simultaneously, parallel imaging reduces scan time while maintaining image quality. This advancement has significantly improved patient comfort, reduced motion artifacts, and expanded the clinical utility of MRI. Echoplanar imaging, EPI, is a fast imaging technique that enables the acquisition of entire MRI datasets in just a few seconds. Its ability to capture multiple images rapidly has revolutionized functional imaging, making FMRI and diffusion tensor imaging, DTI, feasible. EPI's speed and efficiency have paved the way for real-time imaging and rapid assessment of time-sensitive conditions. Gradient echo imaging is an MRI technique that utilizes gradients to create images with enhanced contrast. By manipulating the timing and strength of gradients, this technique is particularly useful in visualizing blood vessels, cardiac structures, and susceptibility-induced contrast changes. Gradient echo imaging has proven invaluable in diagnosing conditions such as vascular malformations, aneurysms, and hepatic lesions. Arthrography is a specialized MRI technique that involves the injection of contrast material into a joint space. By combining the advantages of MRI and contrast-enhanced imaging, arthrography offers detailed evaluation of joint structures, including ligaments, tendons, and cartilage. It finds extensive use in diagnosing and assessing conditions such as labral tears, joint instability, and articular abnormalities. Anerography is an MRI technique specifically designed for imaging the small bowel. It provides excellent visualization of the bowel wall, allowing for the assessment of inflammatory bowel disease, Crohn's disease, and small bowel tumors. Anerography offers advantages over other imaging modalities as it is non-invasive and does not involve radiation exposure. In conclusion, magnetic resonance imaging, MRI, techniques encompass a wide range of specialized imaging methods that revolutionize the field of radiology. From visualizing blood vessels to assessing brain function and evaluating joint structures, MRI plays a crucial role in diagnosing and monitoring various diseases. As future medical professionals, understanding the principles and applications of MRI techniques will equip you with essential knowledge to deliver optimal patient care.